Good evening, and welcome to another episode of Doc Talk with your favorite, Dr. Raven D, the nation's leading psychiatrist. In this particular episode, I really want to dive into one of my most infamous yet dangerous patients, Dr. Hannibal Lecter. In our many one-on-one sessions, it's been made apparent to me that he is most definitely suffering from antisocial personality disorder. Now, to better understand how this disorder affects the patient, let's dive into what it truly is. It is a personality disorder characterized by a long-term pattern of disregard or violation of the rights of others. These patients exhibit a very low moral sense or conscience, and they often have a really robust history of crime. Many patients do not conform to social norms, and they repeatedly lie and deceive and may act impulsively. In the many sessions that I've had with my patient, Hannibal Lecter, it's clear that he is calculated, cultured, charming, and educated, and very distinguished. And interestingly enough, he's also a psychiatrist. But he is dangerous. He seems to lack remorse for his actions as he manipulates and exploits others. And he exhibits narcissism and very violent behaviors as he finds himself participating in activities or behavior that results in the untimely death of his victims. Oftentimes, he seems to ingest the flesh of his patients. In my sessions with him, we've talked about recovery. We've talked about, some actions that he can take to kind of reconcile his behavior. One in particular would be specifically psychotherapy. Now, psychotherapy is actually really effective for gaining insight to symptoms, and it also allows Dr. Hannibal Lecter an opportunity to talk through his thoughts and his behavior. One particular notion that I want to try with him, which I will be attempting in my next session, will be cognitive behavioral therapy, which really takes a hands-on practical approach, and its real true goal is to change the patterns of thinking, which in turn changes the patterns of the behavior, which is the ultimate goal and which is the advantage of the therapy. However, the disadvantage is that it's short term, and for someone as volatile as this patient, he needs more of a long-term therapy. I would also indicate that it's not much biomedical treatment that I can provide for my patient, unfortunately, as there really are no medications specifically to treat this particular personality disorder. However, I will be prescribing a mood stabilizing medication, which I think would be very helpful. So in this instance, I really was able to dive into the mind of this patient and really kind of pinpoint some of the characteristics, the behaviors, and how we're going to look to remedy those. I really appreciate you joining Doc Talk Live here with your favorite host, Dr. Raven D, and we really hope to see you next week while we tackle the complexities of the infamous Ted Bundy. Thank you and have a good night.